what plans do you have to try to improve the health status of the state of Oklahoma? As you mentioned, our health status ranks at the bottom of the 50 states. What plans do you have to try to change that?
There's all kinds of great programs throughout the state, and I want to mention that the Oklahoma County Medical Association has done some great things with hospice, with free clinics, with your Healthy Kids Coalition type programs that you had, talking about smoking and vending machines and healthier eating and food in our schools. And those are all important goals of mine, is raising the bar and making sure that we educate our public on healthier eating lifestyles. I think is very important. It starts with our young kids in our schools, with what we serve in the school nutrition programs. I think it starts with physical education in our schools, which I think we need to do a better job of. It starts with more tobacco education and prevention in our state, and I've worked with you guys on that for many, many years. Starts with looking at programs like our mayor's program and putting the City on a Diet type program, where the mayor talked about obesity and how that affects our health outcomes, how it affects even our state budget when we pay for those costs. Talking about how we can raise incomes, certainly of the state of Oklahoma, providing better paying jobs, as we know that poverty is also an indicator of health outcomes, a leading indicator of health outcomes in the state. And so providing those good jobs and opportunities will be very important. And working with our various companies in the state, I know that Quick Trip in the state of Oklahoma has a medical clinic that they have of their employees. There are great examples like that throughout the state. Also working with programs like Insure Oklahoma for those who are uninsured, those who can't afford to provide health insurance as small business owners, those who can't afford to be able to purchase health insurance as individuals, making sure that we have the funding available in the Insure Oklahoma program. It's a great public-private partnership for those that are uninsured. And there's a lot of great private sector partnerships out there, a lot of great community services out there. My church, Crossings Community Church, has a great clinic too, but bringing in more faith organizations to help. He's giving me the signal, that's a no. Yes, sir.
One of the things that I've noticed over the last 5 or 6 years is an increase in the comprehensive health centers that we have, not just in Oklahoma City, but in certain parts of the state. And having had the chance to tour several of those in different parts of Oklahoma and look at and observe is the better word, observe the people who are coming in there, it is clear that they are beginning to appreciate the fact that these centers offer more than just the medical doctor, that there are several different kinds of services that are available there. So it's kind of a one-stop shop. Many of you have been involved in those in this area, and as a society, you all have been very helpful. And we need to make sure that those kind of efforts continue around the state. But I also believe that we have to do more at the local level, and the opportunity to make sure that programs are being created that can reach into the households, into the homes, so that parents have an opportunity to be able to change their own culture has to start with education of the parents, because the kids are going to do what they see their parents do. Now, the reverse has happened with smoking. I mean, I really do believe that the program in schools where they try to get kids to say they won't smoke, and when they got in the car and could smell the smoke in the car, and "Ooh, Mama, quit smoking," part of that has helped reduce smoking in the state of Oklahoma. But I believe that our county health departments can do a better job of trying to reach out to families that don't have access, don't get on the internet, don't do the kinds of research that many of us are becoming accustomed to. And we have to take this to the local level if we're truly going to change Dr. Deckert's report card.